So very happy to take questions. So, okay, mate?
Yeah, all good.
Yeah.
Thank you, Baz.
Thanks. Thank you, everybody. Well, obviously, we welcome this increased spending on the critical needs in our hospital system, in particular Charlie's, and we saw last week in particular a litany of errors and issues and problems that were identified by the staff that needed fixing. So whilst we welcome the $50 million that has been committed and the audit that has been committed, it hasn't escaped my attention, that's for sure, that less than a week ago, the Premier of Western Australia ridiculed me, the Libs, the opposition and others who raised these very serious concerns. And in fact, in the parliamentary chamber less than a week ago, last Tuesday, I asked him, would he commit funding to fix these problems and would he commit to an audit? Two things that he has this afternoon announced. So I ask on behalf of the people of Western Australia, why were these issues not taken seriously last week? Where was the application and concern for the people of Western Australia and those very important healthcare workers when they raised their issues last week? Why were they waved away and dismissed? Why was it a continuation of the arrogance that's become a hallmark of this government? And I also asked the question, I've got a copy of it here, the relevant page, the 2019 Sustainable Health Review done by the state government. It called for a number of things 6 years ago. One of them, an audit into the very area that's been announced today, and also for increased funding to be committed to fixing these problems. That was 6 years ago. The 2019 Sustainable Health Review. Here it is. Why is it that 6 years later it's only being actioned today after a week of publicity that has demonstrated to everybody the severe failings of this state government when it comes to managing health?
Is that Bolton Barnes inquiry audit just a means of kicking the can down the road, hoping the flu season goes away and then your ramping figures get better?
Well, I assume it's going to cost an additional amount of money to appoint and to employ those very highly accomplished people in this space. So there's that consideration as well. Look, I can't speak to the motivation of the state government in terms of who they're employing. What I do know is we called for an audit last week. We called for urgent funding last week. We were ridiculed, waved away and met with a total lack of humility from the Premier. He didn't want to know about it. I also note at the press conference today, after we heard the Prime Minister yesterday say, when it comes to aged care beds, he believes the federal government is doing enough. And yet we hear today that the state government is still on their way to Canberra sometime next week to go and ask for additional support. The Prime Minister made his position very clear yesterday. I'm still not sure why the Health Minister or the Aged Care Minister didn't meet with the Prime Minister while he was here yesterday, but nonetheless, we don't know who has responsibility for this very critical area. And again, I'll say, the $50 million is welcome. The audit is welcome. But that does nothing to address the issues of record ambulance ramping. And it does nothing to address many of the other issues and failings that we are seeing from this state government in regard to the management of the health system in Western Australia. Again, I'll say it, as I said many times last week. We have world-class health workers. But again, it's been demonstrated we do not have a world-class health system.
Should they have at least put a date on the review rather than a never, never?
I'd like to see everything move forward and move forward with urgency. But again, I ask the question, why was there no application like this last week? Why did the government use 3 days of question time to try and dismiss and deny and deflect and dispatch these concerns in every other direction? And why was it that they didn't address these fundamental issues last week when they were being raised very, very publicly? Suddenly, after a weekend to think about things, they've decided this urgent action is required. Well, that's interesting, isn't it? Where was this last week?
So why do you think they're doing it now? Is it just political expediency?
I think it's very clear that the issues and concerns that were raised by the opposition, by all of those healthcare workers, by the AMA, by the Australian Nurses Federation and by many, many members of the general public whose loved ones have been through our public health system, things are not up to scratch. Things are nowhere near good enough. We don't have a world-class health system. And finally, belatedly, the penny has dropped for this state government. But the people of Western Australia are onto this state government. They know their tactics now. They know that they'll deflect, dispute, deny, do anything other than address the issue until finally they realise, uh-oh, we've been caught out here, we're in trouble, we better do something. And that's what we saw today. $50 million is a considerable amount of money, obviously. I note it is, by their own figures, $100 million is what is earmarked for the overhaul of the emergency department at Sir Charles Gardner Hospital. So $50 million for 3 hospitals for upgrades seems like an amount of money that might only just do some of the most essential work. I'll also note that the $50 million, we're not sure where it comes from. But as I've said many times last week and many times repeatedly over the last month or so, there's $217.5 million sitting in a project that nobody wants, there's no desire for and no demand for. And yet the state government stubbornly refused to allocate all of that money to this issue. That racetrack money should all be allocated to fixing the problems that urgently need attention on. Yet they've only allocated $50 million. And the public of Western Australia have every right to say, why is a racetrack being prioritised above the urgent needs of our health system?
Given that Parliament is back, what sort of scrutiny are you going to focus on as opposition?
Might talk about health tomorrow, you never know.
Yes.
Yep. Nothing new announced today.
You know what this means?
What does it mean?
Oh, you've got to lower the microphone. She's short like me.
Yeah.
Doesn't mean anything else.
Nothing new announced today to combat ramping.
The Cook Labor government have been dragged kicking and screaming to this announcement today, but still our patients will be waiting. In fact, 10% of our patients are waiting more than 12 hours inside our urgent emergency departments. This doesn't do anything to address ambulance ramping or the elective surgery wait list. We know that more than 10% of patients are waiting more than 12 hours inside our emergency departments. This has a significant impact on mortality, patients waiting in pain, and while we welcome this announcement today, it doesn't address the broader issue of ramping, and quite clearly the government have been kicking and screaming to this announcement. No? Okay.
Right, thank you.
Thank you, everybody. Cheers. Thank you.
Thanks, Mace.